Well, thanks for joining us on Euronews Now. First of all, what effect is the pandemic having on the care of premature babies in hospitals?
The actual effect of babies born preterm is that some hospitals have realized that there is a reduction of preterm births, especially in the industrial world. But honestly, the most impact we have at the moment is that we have a more or less total separation of parents and babies born preterm. So parents are not allowed to be with their baby, or they are separated for only 5 minutes a day or even a week. And in some areas in the world, they even cannot see their baby at all, only after discharge. That means for preterm babies, sometimes several months later, they can see the first time in life their baby.
What effect does that have on both parents and child when they're separated?
Well, one of the key aspects for both is the mental health aspect. You can imagine if you not see your baby for several months or even just once a day for 5 minutes, that this has an impact on the bonding. We know that with this effect, the breastfeeding rates are going down, or providing breast milk is really life-saving. So babies can have severe complications because of not having breast milk. And one of the aspects also is the sepsis rates or infection rates is even higher when the babies are separate from the baby. So it's really a life-saving aspect.
And you think that the COVID situation is aggravating the problem regarding premature babies in hospitals at the moment?
Yes, it's really a huge impact what we see at the moment. We have parent organizations from in more than 100 countries, and we hear really dramatic situations. Also that not enough gloves, not enough masks are available. So also the nurses and doctors suffer from this situation. And it depends really on the country or even in the hospital how the regulations are. And the parents and the babies, of course, later in life will have consequences.
Are lockdown measures also having an impact on premature births?
Yes, this is a positive impact we see at the moment. We not have clear data yet, so there is a new study going around to see. But in Denmark and in Ireland, we have seen the first data that the rate of prematurity seems to go down, but it's not really, I would say, a clear fact or figures. It is a first, first numbers we see, but I cannot really say that it's evidence-based at the moment.
Well, today is World Prematurity Day. What do you hope to achieve from today?
Yeah, organization EFCNI, the European Foundation for the Care of Newborn Infants, has founded this day 2008 with parent organization that these babies get a voice. Well, we haven't thought to come into this pandemic situation, but our idea was really to give these 15 million babies who are born every year preterm a voice and their families, because the separation situation was even before, and a family-centered care approach or even the surviving rates are differ really from country to country, and we wanted to have really a more equal situation of the surviving, but also on a quality of care situation across the world.
Silke Mader from the European Foundation for the Care of Newborn Infants, thanks very much for joining us on Euronews Now.
Yeah, thank you for inviting me.